So I'm going to be talking about how do we implement a multidisciplinary breast center. So all breast cancer patients deserve the highest quality of care. Indisputable fact, right? I don't really need to say anything else. I'm done with my talk, right? But let's talk about some stats around breast cancer. Breast cancer is affecting, in general, half of the population, but it is the #1 cancer in America. And thankfully, it's the #4 in mortality. 1 out of 8 women are gonna develop breast cancer in their lifetimes. So everybody here has it touch their life in some way, whether you personally have it or you know somebody who had it or you have a patient who had breast cancer. It affects all of us. So how are we sure that we're giving our patients the best care, right? If you ask a doctor, like, we're all doing the best for our patients, right? As far as surgeons go, what's the hardest question you can ask a surgeon? You ask them, who are the 2 best surgeons in your area? And then wait and see how long it takes them to figure out who the #2 is, right? So hopefully we all are committed to giving our patients the best care. But how can we really prove that we're doing that? First of all, we need to look and see what the gold standard for treatment is, timeliness of care, what kind of metrics should we be trying to reach for our patients? And then we need to see, are we meeting those metrics? And if we're not meeting all of the metrics that we set up, what are the gaps? Why aren't we meeting it? Is it because we need more team members to take care of a high volume of patients? Are we not asking the right questions? Do we not have all of the services that we need? And then even after we look at those gaps and get everything fixed right now, we need to keep checking back in. Are there new innovations that we need to be adopting? Did we maybe drop the ball a little bit somewhere? We need to review what we're doing for our patients. And we have to be willing to change because medicine is changing, new things are coming out every single day. Breast cancer specifically has a lot of practice-changing discoveries every single year. So it's really important to stay up to date with all the innovations and improve your program. So in breast care, we have a lot of guidelines. We have a lot of different bodies that tell us how to organize a breast center. The one that I picked to focus on is the National Accreditation Program for Breast Centers, NAPBC. And so what does this look like? The NAPBC sets up multidisciplinary standards for breast care. So surgery, medical oncology, radiation, nursing care, occupational therapy. They have very strict guidelines for what kind of metrics you need to be hitting for every specialty. And they're giving us those quality measures. There's also opportunities to participate in clinical trials when you're part of an NAPBC program. And they're really encouraging professional education, collaboration across different systems. And there's also parts in there that encourage and require you to have patient advocacy. And then they're setting benchmarks so that we can compare how we're doing across different programs so that we can all make sure that we're aligned with what is best for our patients, not just within our own institutions, but nationally. So how do we get started? They have an 80-page manual from 2018. There's going to be a 2024 manual coming out, and it's dense. It has every single thing just painstakingly written out, and you have to meet every single one of them if you want to get this accreditation. So it's a daunting task for a single person to just whip out this manual and start going through it step by step. So the first thing that we have to do and that we did at WakeMed is get our team together. So who is this team that's going to be starting the process? Well, that was the hardest part, just figuring out who is committed to making this happen. And luckily, there were quite a few people at WakeMed who had done this at other institutions and were really committed to making it happen. So on our small group team, we had a pathologist who came from an institution that had everything done with NAPBC. We had a radiology manager who from the radiology standpoint was able to get everything up to par. We had our medical oncology executive director, also came from an NAPBC program. Our tumor registrar, who is the person who is sending all of our tumor data to the state, which is required. So that's gonna be the person who's gonna be able to pull our data so we can actually look and see if we're meeting all of our metrics. And then there's me also. So beyond getting that small group, which is gonna go through every line of that manual, make sure that, see what we have, see what we don't have, where are our gaps, we need to get a breast program leadership committee. So this was the goal of my project, was to set up our breast program leadership committee and have our very first meeting. And my project ended at step 1. So we're working towards step 2. But it's important to know where you're going and do everything properly. So we have the team in place to get to step 7, which we're gonna get to by the end of this talk. So the Breast Program Leadership Committee is different than that small committee that I was just talking about. This is gonna be mostly comprised of physicians, the oncologist, surgeon, radiation oncologist, but also nurse navigators, physical therapists, occupational therapists, patient advocates, social workers. You also need to have at least one patient from the community on the group so that they can also help ground us and make sure that we're also keeping the patient and their needs at the very center of what we're doing. So the next step was to identify this group. So we do have all of the stakeholders. Everybody has committed to joining the group. So part of step 2 is done. Next, we need to go through the gaps, kind of back to the first group. We need to go through the gaps. We need to go through the credentialing and all of those small details in that manual. Go through it step by step, make sure that we're not missing anything, so that then when we have our first leadership meeting, we will have the data. We will know how many patients we're treating, what kind of treatments they got, what was the timeline of their treatments, what were our outcomes. And so then the leadership committee, when they meet, they can actually go through all of that data, decide what our protocols are gonna be, what our benchmarks are gonna be, and we're gonna ratify our protocols. We're gonna repeat this meeting quarterly, go through it every time, make sure that nothing is slipping through the cracks and that all of the innovations that we need to make happen are happening over time. Then, only then, we're gonna be able to finally apply for our accreditation because we need to have all of the things in place prior to applying. It takes roughly 2 years for an institution to get to that point. And so we're about 1 year in, so hopefully 1 more year and we'll be right there. And then finally, it's important to stay committed to lifelong learning and improvement. Once you get that accreditation, you can't just put it on your website and say like, we're doing it for our patients, we're the best. You need to walk that walk and keep reevaluating. Look at all of the new treatments that are coming out, and you wanna be adopting those treatments as soon as possible. Not just because you wanna compete with the other institutions, but because it's the right thing to do for your patients. So I know that this has been very nitty-gritty on breast cancer care, but these steps of going through data, reviewing your data, instituting protocols, and repeating, this is something that should be done across all specialties to make sure that we're doing the right thing for our patients. So finally, it's been a little bit of a daunting task, but how do you eat an elephant? It's a chocolate elephant. You gotta start one bite at a time. So thank you for your attention.